My typical day is probably not really an active answer. It can be defined by, I would start to say a balance, but really probably like an imbalanced rotation of the different roles. So I have sometimes where I have roles on clinical services, institutional leadership, and then involvement with the AAN's public health education through Brain and Life. So for about half of my year, or 50% of my time, I'm on clinical inpatient neurology services. So those days, I'm spending more of my mornings rounding with the team as a neurohospitalist or with our inpatient epilepsy teams. And in the afternoon, then I'm catching up on a balance of some of those other roles, either through the department, at the medical school, or with Brain and Life. I also work at least 1 or 2 days a week supporting an EEG lab at our New York public hospital system, or the New York City Health and Hospitals. And then the afternoons of a lot of days, I'm spending time at the medical school as the Associate Dean for Community Engagement and Outreach, where I actively support initiatives for pathway programs towards the next generation of not only medical school students, but also PhD students and other health and science professionals. And then, the weeks where I'm just have my medical school support time, then I'm working in small group education, either within neurology, or a lot of this advising time that I have with medical students, along with education for our pathway programs. And it's sprinkled in throughout all of these weeks, I work with the Brain and Life team for both the magazine on the editorial board and as the editor and host of the podcast. So probably once or twice a week, I'm preparing for an episode, meeting with our podcast team, doing some background reading and or listening to other podcasts about that person I'll be interviewing, or the medical expert I'll be getting information from for that episode. And then we record for about an hour, probably once or twice a week. It depends on where we are in the season. And so those are sprinkled into any week, and it's much more dependent on the person I'm interviewing and their availability and where that lines up for me. So my days can be quite a mix of different activities, both online, in person with students or patients, and back and forth between two campuses. Yeah, so my interest in academic neurology, I think, largely came from the inspiration of the mentors and supporters and everyone that I saw around me. I mean, the passion and dedication that I saw that others poured into not only their education, but then the development of residents and trainees over time really made me want to stay in that kind of supportive environment. And then a lot of the academic settings are also settings where there is more of an opportunity to work with safety net hospitals and support a broader scope of patients. I started my training in the military medicine system and training at Walter Reed. And so that was both an academic center, but then the military medicine system is one of, in a way, the only social medicine, functioning social medicine programs within the United States. So I got an opportunity to train in a system where, at least at that time, I wasn't navigating and thinking about prior authorizations and all of the other aspects that are now a part of all of our lives. And I liked that opportunity, and I like sometimes in the academic setting that there can be more of a frank discussion about what we think and want to do next, just based off of our assessment and knowledge of what's going on, or have more time for the academic and background discussion on that. And then, later, or as a different part, maybe talk more about the business and the other aspects of medicine that are required to make sure that person gets the care that they need, or that the department is getting, the reimbursement and the compensation that's needed to keep things moving forward. But I didn't I did not want to be particularly in a role where that was the first part of the thought process, at least in my training, and I've enjoyed staying in the academic setting. So for me, my career has evolved through very distinct phases. It was, initially defined by military service, then moving through into subspecialty training after working in the military, and then a growing commitment to working within a healthcare system, leadership within that system, and then public education and outreach. So I started in military service in the U.S. Army Medical Corps. I did a military medicine scholarship for medical school. So through that, then proceeded into a U.S. Army neurology training program at Walter Reed, and then worked for the military, advancing to the rank of major. After training at Walter Reed, I went to Dwight Eisenhower Army Medical Center in Augusta, Georgia. There very quickly, as happens sometimes in the military because of needs and roles, I stepped into a deputy chief role for that division, and then later as the chief of neuroscience and rehab. And so very quickly, those kinds of situations, a leadership role was needed, administrative tasks. I had to learn all of a sudden how to manage also like a budget for the division and the clinic, managing a variety of staff. And so I think the mentorship and leadership mentorship that I received in that context helped me a lot with other opportunities later. And then, gave me really opportunities to step into clinical education and coordinate students and residents coming to and learning in neurology in a very smaller hospital setting. And then from there, as I finished my military service time, I moved into an academic center here in New York City at the Bronx, where I came for my clinical neurophysiology training. And then I stayed here doing a master's of Science in Clinical Research Methods at the Albert Einstein College of Medicine. And through those opportunities, got to develop more in research methods and thought process, mentoring for students and trainees within research methods, and looking more at the different ways I could get involved in clinical research, health equity issues, and public education. And then from that, I stepped into the American Academy's Leadership Development Program. I was able to join one of those programs, and from that, really developed and had a clear understanding of my interests in public health education and outreach, and improving understanding across neurologic disorders and about brown brain health. And started to then get connected with both the Brain and Life magazine editorial board, but the AAN's growing initiatives to engage the public and expand brain health education. So eventually joined committees related to the Brain and Life magazine and the Brain Health Initiative. So for me, one of the most rewarding aspects of a career and each day in academic neurology and in academic medicine is, getting a chance to make a tangible impact, not just in the patients' and families' lives, but to think about the thousands and millions of potential patients and families we'll impact by helping invest in trainees, and then bringing and expanding public health understanding for the broader community. I think, when you really get a chance to think back of the potential that you can make for a change and improvement in many different hospital systems and healthcare areas by investing in a group of medical students and multiple different residents, really means your impact will exponentially be much larger than the patients will see each day on those services. So I really like that there's kind of both sides that I get to be involved with in that setting. And then in academic areas, there's always often these other roles on the public education side or the healthcare education side that sometimes help balance out when there are very difficult problems that just cannot be fixed for a family, for the community, for a patient, or difficult situations clinically that really impact you personally and emotionally, it's nice to be able to go back to some of those other roles and feel like, well, maybe today I was able to be there alongside and emotionally support that individual and family, but I couldn't offer more. We all ideally want to fix the problem, but I can go back, to the school. I can go back to an initiative I'm working on with the AAN and feel like I can contribute to improvement and a broader impact in a different way to, balance out some of the different areas where sometimes it feels like you can be chipping away and not getting anywhere. So for me, I think my advice to many trainees, whether it's specifically academic neurology or any field within healthcare and particularly academic medicine, I frequently, I have valued, and so much of what I do and the opportunities I've had have directly connected back to the mentors or really the supporters that I've had throughout my career. So I say, first, seek out and really truly value the time that you get with mentors. I'm going to come back to these, and then, define over time and work with those mentors to get a sense and define your area of interest that you want to systemically impact the community or your field. And look for and be open to embracing kind of a variety of roles and leadership opportunities around that. And that's not necessarily always going to be directly related to the patient care or the research, whichever is your primary area. And I think always look to engage the community and the public, even if it's just to have a different perspective. So, in terms of the mentorship side of things, I think a career in academics really requires those strong relationships and finding mentors who can guide your professional alignment with your interests. But more than anything else, really pay attention to notice beyond a mentor the people who are true supporters. They might be colleagues, they might be like more senior advisors, where they actively think of both developing and identifying your strengths, but also they think of where and when your voice is needed as a seat at the table. And they're genuinely seeking your personal development and what you want, both personally and professionally. And not just training like a protege mini me who's going to take over my lab or this work that I'm doing. That's great if all of that aligns up for you. But if not, then you really get into this challenge of this person has poured in so much work for me and I feel a responsibility to that. But you should feel that they also want you to genuinely continue the areas and the things that you're interested in, and it's perfectly fine. Like from my perspective, if I pour all of my passion and interest about epilepsy into a student and that encourages them to go into cognitive neurology, great. That to me, that's a win, that they found their direction and not, oh man, they didn't choose neurology or epilepsy or the area that I showed them. I showed them passion and they found a direction for that for them. And for me, in terms of defining a systemic area of interest, I thought about the things and the challenges that I'd seen in my communities, in my own family. And so for me, that came out to be, working and an evolved focus in health literacy, and equity issues and expanding understanding around neurologic issues. But that came out of just frequently seeing these as problems in places where I felt like I had tools or I had a network of people to work together with to address them. So it doesn't always have to necessarily be the tools that are in your pocket, but that you can also then think of other people who should be joining you at the table or should be there in your place. I think looking at other organizations in terms of embracing other roles and looking for other leadership opportunities, getting involved with the AAN has been integral into many of the different steps I've taken it. It's been helpful to see perspectives of how things are done at other places, in other regions, even around the world. Involvement through the American Epilepsy Society and the International League Against Epilepsy have helped within that context within epilepsy and across the country and internationally, to really look at the strengths that they have in different systems and in different places, and not necessarily to look at, oh, it's just we or my place does it best. Lastly, like I said, engaging the public, finding a way to either just hear a different perspective or even that practice of translating the complex concepts and topics. And sometimes that public might be just explaining your job or the things that you care about to your family, and that helps you further improve and refine your communication skills that we do with patients and families.